So, hello, good morning friends. We are starting with the demonstration of rotator cuff anchors. And if you talk at present, the most preferable anchor that we use for rotator cuff repair, irrespective of the company, is a PEEK anchor. PEEK is basically polyethyl ether ketone material, and this material is at present the material of choice for rotator cuff repair. The reason being is it has got a better pull-out strength as compared to titanium because it is a completely threaded anchor, and the threads are actually looping at the tip of the anchor. This is in contrast to the metallic anchors. Most of them have an eye here, and that gives a loss of fixation in the metallic anchors which have eye. So we don't recommend anchors with eye at present because they lose fixation at the cortical level. So PEEK anchors are predominantly preferred anchors. The advantages of using a PEEK anchor are: one, they are bio-inert, they have a good fixation strength, and they do not cause any sort of reactions with time. We also used to use bioabsorbable anchor, biocomposite anchors, but occasionally there were instances of developing reactions because of the material, which are lytic reactions around the anchors, loosening of the anchors, which is not seen in the PEEK anchors. Now these anchors will not be visible on the X-ray, but occasionally you will see when you punch, so you will have a faint line of the punch that you can see on the X-ray. Now there is a full spectrum of anchors that we can use, and this depends on the type of the repair that you want to perform, and there are multiple variants of anchors which are available. We all know that in the proximal humerus, the bone density may vary as far as patient to patient. So there are patients in which there is a very good bone density. There are patients in which the bone density is not very good, osteoporotic patients. So we have three series of anchors, three diameters of anchors that you can use in a cuff. The first is a 4.75. This we use for most of our patients. The advantage of using this anchor is you can place more number of anchors, and if the bone stock is good, they will have a good purchase. So 4.75 is my preferred anchor, which I use in most of my cases. If the bone is little soft, osteoporosis is there, you can use an anchor which is a 5.5 mm anchor, which is a little deeper threads and can be used for osteoporosis. And in those patients who are having a severe osteoporosis, we can use an anchor which is a 6.5 mm anchor, which is even thicker than this. So three diameter variations are there. Now the advantage in this osteocare PEEK anchor series is you have variations in the individual anchor as well. So if you talk about 4.75 mm anchor, so there are three variations available. The first is an anchor which has got both threads. So you have threads on both the sides, and these are wires number 2 ultra high molecular weight polyethylene fibers, and they are sliding sutures. So 2 fibers number 2 which are sliding. The second variation is a tape lock. So you have one suture here and one tape here, and this tape is non-sliding, so that is called as a tape lock configuration. The third configuration is a flexi tape configuration, in which you have a fiber which is sliding and a tape which is sliding. Okay, so you can do the repairs in three variations in each. So if 4.75 anchor, you have an anchor with sutures, you have an anchor with tape, you have an anchor with sliding tape. So sliding tape, non-sliding tape anchors, one tape, and then you have an anchor which is both the sutures. You have a triple loaded options available also. So you have a triple loaded 4.75 anchors as well. So you have a full modularity and options to choose among what anchor do you want to use for your particular patient, depending on the extent, geometry of the tear and the strength of the bone or the osteoporosis. So if there is an osteoporosis, you might try a 5.5 anchor, and if occasionally your anchor pulls out, you can interop convert it to 6.5 mm anchor. The same is with the Nautilus counterpart. So the Nautilus anchor again will be available in 4.75 and 5.5 mm variants. Again, they will be available in two variants. One is a metal tip self punching, and the other is a peak tip, which needs a pilot hole. Now the inserter is a common inserter for both, and this inserter has a marking. So if you want to insert a 4.75 anchor, you want to tap it here, and if you want to use a 5.5, you need to mark it here. So two levels are there. Now this is not absolute. Why it is not absolute? Because the bone density may vary, and if you feel that your bone is soft, you might not go completely in. You can just make a pilot hole and use your anchor to make the full drill. So again, it is a variable thing. So you need not to follow this marking. This is just a guiding mark, and then occasionally you need to see. Now these anchors can also be used for research in Bangkok, but in those circumstances, this is a very hard bone. So you need to have a very good tapping so that an adequate hole is made after the insertion. So these are the important things that you want to remember. Now this is a path in which we will just tell how we can insert anchors and do the repairs. Now rotator cuff repairs, I usually classify them in 4 generations. The first generation is a single row repair, and second, third and fourth generation are double row repairs. So single row repair, whenever we are doing in a fashion which is called as a Mason-Allen repair or Mason-Allen fashion. So we will be just demonstrating one single row repair, and after that we will be demonstrating the double row, all the 4 variants one by one. Okay. If you are doing a single row, so let's demonstrate here. In a single row repair, please hammer. So what we'll do is we'll just make a pilot hole. So, and then this is a single loaded anchor, and we'll just insert the anchor. And after that, once you have inserted the anchor, so you have 4 threads here. So you have 4 threads. So here it is a triple loaded anchor. So there are 6 threads which are available. And what you need to do is you need to use some of these sutures as a double row and some of these as a single. In a Mason-Allen, you would use one double passage, that is a one mattress, and one simple. So what we will do is we will pass the sutures one by one. So what I will do is I'll just use, you can use any sort of a suture passer, pass it like this. Okay. And now when you are using these sort of suture passers, you can use 2 of these together. Okay. Okay. So this is my first. Okay. So here what we will do is we will use 2 of the sutures as a mattress, and we will use one of the suture as a simple suture. So what we need to do is we need to have at least 5 suture passages. Okay. Okay. And one more. Now this black suture will be using as a simple suture, and this white will be using as a mattress suture. Okay. So the white suture we have kept as a simple suture, and rest 3 of them will be using as a second 2 of them will be using as a mattress. You can put it again. Okay. So in a single row pattern, what we need to do is we need to keep one of them as a simple suture. So this one will be acting as a simple suture, and you can just try this. So when you're tying a simple suture, you need to use the suture which is passed through the cuff as the post, and then you can use any sort of a configuration. Here I am using a Mason Allen configuration, and this is called as an SMC knot. This is my knot pusher. So this is my single suture. Okay. So this is my first configuration. After that, I will be tying this one and this one, and this finishes my Mason Allen repair. This is my second, and this is my third. Okay. Okay. Again, this is my third. So this forms the single row repair. So where to do a single row repair and where to do double row repair is a matter of great debate. And I will not say single row is bad, but single row is definitely less popular nowadays after the advent of double row repairs. And this is how you used to do. We used to do a single row repair. If you want to use 2 or 3 anchors in this, you can use 2 or 3 anchors in this scenario. And once you are done with your repair, you can just cut the threads. Okay. So once you are done with your repair, you can cut the threads. So here is the cutter, and with the cutter you can just cut the threads like this, and like this. And this is the finished final repair of the single row, which have 2 mattress and 1 simple suture. So this is the first generation repair. You can put more than 1 anchors, but all the anchors are on the same side. The other important thing that you need to do here is you can make small pilot holes here, which is called as a crimson duet, which will increase the biological healing. So if you are doing a single row, you can make small drill holes on the exposed part of the footprint to form what is called as a crimson duet to increase the biological healing in the anchors. Now this is the first generation. Now what is the second generation? Second generation is a double row repair with using the regular anchors. So you will use the same anchors that we have used, but 1 anchor you put medially and 1 anchor you put the laterally, and do the simple, do all the mattress sutures for the middle row anchors and all the simple sutures for the lateral row anchors. Both the anchors will be knotted anchors. Both the anchors will be knotted anchors, and there will be no knotless configuration. It will be a knotted configuration. Medial row, lateral row, all medial anchors, mattress, all lateral anchor is simple. Okay, so that becomes the second generation double. Now comes the third generation. Now third generation, again we have 2 variants. So the first variant we are seeing is a third generation is a knotless repair. So I am just using this one. Okay. So again we will be showing the third generation repair now. Hang on, please. So we are using a peak anchor. Again you can use a 4.75 or 5.5 depending on your patient. I usually, in Indian patients, I usually like to use a 4.75 because it occupies less area and you can put more anchors as compared to a. Now here, since it is a knotless anchor configuration, you need to use a mattress suture. So all the 4 sutures needs to be passed through the passing. So all these 4 sutures needs to be passed through the suture passing. Okay, so in the first suture passage you can take 2 of them, and after that you can take 1 each. Okay. So whenever you're using a shuttling sort of a suture person, you can use one suture to take both the bites together, and rest of the two you need to pass it at different places, because you need to have two suture links at a different configuration area. This is my second configuration. Okay. So this is the second one. Okay. And whenever you are doing a Nautilus repair, it is always a mattress. So you need to pass the sutures, all the sutures of the medial row through the cuff. Okay. So now you can tie them as you tie the. You can tie them. So again we are using a Mason Allen stitch here. So this is SMC knot. Like this. Hold that here. Okay. Now important thing here is you need to. This is a sliding locking knot. So you need to press this knot firmly, and then when you are very confident with your knot position, then when you pull this suture, the knot will lock into its position. So one here and one here. Okay. Okay. Now important thing to note here is the knot will be sitting on the post. So I have made one knot here. Now I want to make the second knot here, because we are planning to do a double row configuration. So now I will take this one as my post. Okay. If I take this one as the post, both the knots will be sitting at the same place. Okay. So I am using this one as a post because I want my knot to sit here. Okay. When I push it here, the knot will sit on this side. Okay. So this knot is here, this knot is here. If you place both the knot together, then you will not be able to do a good double row kind of a repair. Okay. So this one. Okay. Fine. So this we have tied both the mattress sutures of the medial row. Now we will be using the lateral row anchor. Now, as I told you, lateral row anchors are again of two types. So this is an eyed anchor and this is a non-eyed anchor. We are using an eyed anchor for the first thing. So here you need to pass two of them. You need not to pass four of them, because the two threads from the same knot will be the same location. So you will not gain anything extra if you put all of these four threads into it. You get my point? Because a single knot is one fixation point. So if you need to take two from the same, they will both be on the same place and you will not get an advantage. So here what we are doing is we are placing a knotless anchor here like this. And this is this way. We can just place it the knotless anchor like this. And then we need to pull this, ask our assistant to pull this, give a little tension, and then we can just push it in like this. Okay. and this is our double row configuration, which we call it as a third generation double row lateral repair. Now these are the two sutures here. You can use them for the dog ear repair. So these sutures can be used for dog ear repair. So supposedly I want to repair this dog ear. What I will do is I will just pass my suture like this. Okay. And put this in this to do a, okay. So this suture here can be used for a dog ear repair. This is a dog ear repair suture. This is the extra suture which has been given, and it is useful to close the dog ear. Okay? And once we are done, we can just cut all these things with the suture. So this is our third generation rotator cuff repair, in which the medial row sutures are tied, and after that you have a regular knot. So these suture limbs are used to, these sutures are used to tie a regular knot, artifice. So, and we tie them like this. Okay. Okay. So this suture is basically, what does this suture do is, you may have some if when you repair it like this, you may have a pasta kind of a lesion on the middle side, because the middle cuff may be a little bit elevated off the bone here. So this suture will actually repair that pasta lesion. Okay. And if you see this, this is the fourth generation tape lock repair. So this repair is basically more biological because the strangulation part is less. So if you compare this repair with this repair, you will see there is a lot of strangulation here, and the strangulation is less here. So this is more biological, and there are less chances of a Choi type 2 musculotendinous tear if you use this kind of a repair, as compared to when you use a third generation double row repair like this. The biological healing is also better with the second generation repair, in which we don't use a Nautilus. But then you have to use more suture limbs, and technically it is difficult to do because there will be too many suture limbs to manage. So here we can see that the rotator cuff repairs can be repaired in different fashions. Now single row I will recommend for very small tears, in which you have a very small footprint which is exposed, and occasionally you can use single row for a very massive tear, in which it is difficult to put two anchors because it will increase the tension. So in very small tear you can use a single row, and a very massive tear you can use a single row. Rest everything ideally I will recommend to use a double row, either of the three techniques, either using two regular anchors, either using a one knotted anchor here and uses the knotted limb on the limb. And if you don't have any restrictions, it is recommended to use a fourth generation tape lock technique, in which you use tapes and the other suture is just. The other advantage of tape lock is it will be faster also, because you have to tie less knots. So it will be a faster technique also as compared to a third generation technique. Okay, thank you. So second generation double row repair is basically use of double row repairs without using a knotless anchors. So we will be putting two anchors. One anchor is basically on the medial side, and one anchor is on the lateral side, and both of these anchors are not normal anchors. Basically they are not knotless, they are normal anchors. So this is my medial anchor, and this is my lateral anchor. Okay. If the tear is big, you can use 2 medial, 2 lateral, 3 medial, 3 lateral, 3 medial, 2 lateral as per your comfort. So what we do here is, we usually take both of these as a simple. So now this is a very good technique, this is a biological technique also, and the other advantage is the cost also. So this technique will be a less costly technique as compared to a use of a knotless anchor. So the key here is that you have, these are four sutures here and 4 sutures here. All these 4 sutures needs to be passed, and they are more medially, and of these 4 sutures only 2 sutures needs to be passed, and they are more laterally. So what we will do is, we will be passing the first suture here. You can use 2 of them. So this is my medial row, and as I told you, we'll be passing one at a time. So all these 4 sutures of the medial row anchors are passed. Okay. And from the lateral row, you need to pass only 2 sutures. So these are simple sutures basically. Okay, so now these 2 sutures are single sutures, and these 2 sutures are mattress sutures. Okay, so when we are doing this, we use the lateral row first, because that will reduce the cuff to its position, anatomical position. Okay, so when we are doing this technique, you close the first suture of the lateral row first, because this will reduce the cuff to its place. Okay, and then what you can do is, you can close either the other lateral one or the medial one. So this is the medial side. Whatever, doesn't matter. Okay. इसमें फर्क नहीं पड़ेगा, because doesn't matter, because if you want to make this as a post or that as a post, doesn't matter, because we are not using this for the lateral. So these are just sutures, and we close it. Only the pattern or the anatomy will be a double row. Rest we are not doing a knotless repair. So the other technique will be the when using this
Lateral side.
lateral side, this is the post. You cannot make the one on the anchor as the post. And depending on the size of the tear, you can use 2 medial row, 2 lateral row, or 2 medial row, 1 lateral row, whatever you want. And this is the basically the configuration. So here you are use a single row. So here you use a double row. Middle side you use all the 4 sutures, and for the lateral side you use simple sutures. Basically, so this is the configuration as per the involvement of the. So this is the final picture. This is a second generation. So 2 anchors, medial anchor, all the 4 sutures, lateral anchor, 2 sutures. First generation Mason Allen. So you put 1 anchor and then you put some mattress, some simple sutures. Third generation you use medial row, tie them, and then use the tied knots on with the Nautilus anchors. Fourth generation tape lock, you use a tape here, and without tying the tape, you put it on the Nautilus repair, and the other suture you can just tie it immediately. So these are the 4th generation of repairs. All of these are good repairs, so you can use any of them in your cases depending on the geometry of the tear, the pattern of the tear, the affordability of the patient. They are very much and the size of the tear. This is important. Thank you.